Hi, I am SM Sarwar Hussain, intern of Medical College. In this video, I demonstrated you the cardiovascular system examination. In cardiovascular system examination, we have two videos. In first videos, I demonstrated you the examination of pulse and JVP. In second video, I demonstrated the examination of precordial palpation and precordial auscultation. For cardiovascular system examination, what are the things we must look? First examination started with pulse, JVP, blood pressure. Pulse, JVP, blood pressure, then precordial examination. In precordial examination, you get inspection, palpation, percussion and auscultation. So now I started the examination proper of cardiovascular system. So every examination you have to start it with greeting, introduction and consent. Assalamualaikum. English Medical College একজন ছাত্র আমি আপনাদের কিছু পরীক্ষা নিরীক্ষা করব আশা করি আপনার কোনো সমস্যা হবে না Take the consent and then exposure. In cardiovascular system examination we have to expose the precordial area. In this session of examination I only examine the pulses and JVP, so no need to expose the precordium. So examination of pulses. Examination of pulses started with radial pulse, then radio-radial delay, then radio-femoral delay, then peripheral pulses, brachial pulses, carotid pulses, femoral pulses, popliteal pulse, posterior tibial, anterior tibial and arterial dorsal spines. So what are the things we see in pulse examination? In pulse examination we see rate, rhythm, volume, character, condition of the vessel wall, radio-radial delay and radio-femoral delay. First, shake hand with the patient. Just flex the hand and then examine the rate. About 15 seconds. Examine the rate about 15 seconds and multiply by 4. And then rhythm. Rhythm may be regular. Rhythm may be irregular. Rhythm may be irregularly irregular. And then go for condition of the vessel wall. Condition of the vessel wall you have to examine with one finger. And then symmetry. Radio-radial delay. Simultaneously examine the both radial pulse by using your both hand. Radio-radial delay or symmetry. And then go for radio-femoral delay. Where you get the femoral artery? Just anterior superior iliac spine, put your hand in the anterior superior iliac spine, then symphysis pubis. And the middle of this you get the femoral artery. Midpoint of this you get the femoral artery and then press it and feel the pulses both simultaneously. If it is not simultaneously, if there is no coordination between the radial pulse and femoral pulse, there may be pathology such as quadration of aorta. And then you go for peripheral pulses such as brachial pulses. The volume and character of the pulses first better demonstrated in the brachial and carotid pulses. Brachial pulse, use your thumb just medial to the brachioradialis. Bicep brachii, just medial to the bicep brachii. And here use your thumb just medial to the bicep brachii. And then carotid pulse, you have to put your fingers like this and examine the carotid pulse just medial to the sternocleidomastoid at the level of the cricoid cartilage. Not palpate simultaneously in both sides. And then go for femoral pulse, again for femoral pulse, then popliteal pulse, and then go for anterior tibial arterial dorsal spadiis, just interdigital first cleft, first metatarsal space, just this proximal to the first metatarsal space. Just support the feet by your hand and feel it. You doesn't need to count the pulses because we just to feel the pulses where it is present or absent. And then see the anterior tibial and posterior tibial. Anterior tibial between two malleolus and posterior tibial behind the medial malleolus. Anterior tibial between the two malleolus and behind the medial malleolus, posterior tibial. So now we demonstrate the examination of JVP. On JVP examination, you have to lie this patient about 45 degree, such like this. You may get the JVP. Yes, bridge JVP. Maybe pulsatile or non-pulsatile. Suppose we get JVP here. And how we measure this JVP? Such as top of the vertical height of the internal jugular vein you get here. Top of the vertical height of the internal jugular vein you get here. Suppose. And then how you measure it? Find out the external angle. Find out the external angle. Place a scale over here. And top of the vertical height of the external carotid pulse. Take a scale here. Measure here. Such as 1 centimeter or 2 centimeter or 3 centimeter. Normally below 3 centimeter is normal. It is, if it is above the 3 centimeter, it is abnormal. So now also see, if you get the JVP, you also see the hepatojugular reflex. Pressure over the abdomen and see the raise of JVP. It is called hepatojugular reflex. It's all about examination of the pulses and JVP. Thanks.